There are times when you can't go to the hospital right away. In that case, how should you handle emergency care?
Well, it depends on the situation. Let's talk about general emergency cases. Hello, I'm Dr. Kim Gukhan, plastic surgeon at Human Plastic Surgery. After rhinoplasty, many people experience inflammation, but don't realize it and take it lightly. However, if it really is inflammation, you should never leave it untreated. In the early stages, simple treatment or antibiotics can help. But if you miss that timing, you may end up needing revision surgery. So what are the warning signs of inflammation? As I mentioned earlier, early stage inflammation can be treated with simple injections or oral antibiotics. But if proper treatment isn't given in time, the inflammation can worsen and spread deeper. It doesn't just stop at inflammation, it can lead to a bacterial infection. If that happens, even the normal tissues of your nose may become damaged, so you need to be careful. Therefore, if you notice early signs of inflammation, contact your clinic right away. Sometimes it's not easy to tell whether it's inflammation or not. Even from photos, it can be difficult to make an accurate judgment. But there are some typical symptoms: redness, swelling, warmth, and pain when you press on the area. If it progresses further, you may even see pus discharge or other signs of infection. In this case, it's best to contact your hospital. Visiting in person for an X-ray or CT scan to check for implant issues is important. It's not always an emergency, but visiting the hospital for an in-person examination is the most accurate and reliable way.
Sometimes you just can't get to the hospital right away. What should you do then?
Well, it depends on the type of emergency, but usually if inflammation occurs or your nose swells a lot, you can take some medicine and apply a cold compress, not warm, but cold. And that can help a little. And as soon as possible, visit your hospital. That's the best thing to do to handle this. Anti-inflammatory medication may temporarily relieve symptoms before you visit, but it's not a fundamental treatment. Actually, it's not that common to feel severe pain after nasal surgery, but sometimes the cause is something that plastic surgeons can recognize well, and sometimes it's something ENT specialists can diagnose more accurately. For example, last week a patient came in several years after nasal surgery, complaining of odor from inside the nose and pain around the forehead and facial area. We examined both the inside and outside of the nose and referred them to an ENT specialist who diagnosed sinusitis. After surgery, it's best to avoid bumping your nose. Of course, you can't just lie in bed doing nothing, nor do you need to, but you should still be careful not to put direct pressure or impact on your nose. Excessive drinking or smoking can also cause inflammation or infection after surgery, so it's best to avoid them, at least until the swelling fully subsides. You need enough rest and recovery time for your body to heal well, so that your surgical area can recover properly too. Once inflammation has developed, revision surgery becomes much more difficult. That's because inflammation alters the normal tissue around it. So during revision surgery, we first have to remove the inflamed and scarred tissue and even reconstruct any damaged areas before starting the actual procedure. That's what makes revision surgery challenging. For cartilage, we can now use costal or other types of grafts. But when the skin or mucous membrane is deformed, reconstruction becomes very difficult. That's why it's far more important to prevent inflammation before it happens. So you don't need to panic just because you have some swelling or pain after rhinoplasty. However, since it's difficult to diagnose or treat your own nose accurately, you should always contact the clinic where you had surgery and, if possible, visit in person for an examination. I hope everyone recovers well after surgery. Thank you, and take care.